All right, it's Friday. We made it through another week together here where we talk about coronavirus and specifically the numbers here in Arizona. We help you find the information you're looking for so that you can make the best choices for your family. And hello, Garrett. Thanks for being with us again. We
Hi,
have a lot
Katie.
to get to today, sort of a mixed day of numbers. A lot of us, I saw a lot of people retweeting your breakdown of the numbers today, but let's get right to the summary page and show folks what it looks like here in Arizona and remind them in the live comments, ask us anything you'd like us to help you find. We can dig into the numbers. We look at these sites every single day and we can help you find the data behind everything here so that you can make the best choice for your family as well. So Garrett, the summary page this morning.
Yes, the summary page this morning, here's where we are. 138,000 cases, just under 1 million diagnostic tests. Oh, excuse me, that's everyone, 969, that's total tests. That's 764 PCR tests. So we have 3,900 cases today, and then 91 deaths were reported today. So, I mean, that's we've had several days now with fairly high death numbers.
Yeah, we had several days this week that were in the 90s.
Yes.
And what else from this summary page caught your eye today?
We had I believe this is a record number of diagnostic tests today, 15,664 reported in one day. That gives us a percent positive of 14.4 for the total. That is up 1/10 of a point. The total percent positive for the day was 25%.
25% in the overnight numbers that were coming in. We want to talk about that high number of deaths and get right to that. So the page that you're on is so helpful for people, but where specifically, when they log on in the morning, where specifically can our viewers find that number of deaths?
So if you want to look to see what the state has recorded for death numbers, you would go to the AZDHS.gov dashboard and you would go to COVID-19 deaths right here. And then you scroll down and it will show you basically the entirety of what has been recorded so far. So 2,583 deaths, 91. You can see where they've gone by county. And here you can see this is what's called the epicurve. I know we've gone over this a couple times. And this epicurve is the actual date of occurrence. So this is when the person actually died from COVID-19 or it was recorded and coded that they died. And as you can see, right now we have, it's gone up. It's been going up quite some time now. And while this graph does take about 12 to 15 days to backfill, as you can see, these most recent numbers are very low, and it takes about 12 days to backfill. We can expect, several weeks now, we can expect to see numbers that will bring our numbers up to these numbers, up to these June 30th, kind of late June, early July numbers that are very high.
So as these numbers are plugged in, our deadliest day sort of adjusts to the data. Where is our deadliest day in this chart so far?
June 30th is the peak death day, and that's with 57 deaths.
57 deaths. We'll continue to track that. Garrett, one question: How much more loss have we experienced this summer here in Arizona because of COVID-19?
So the AZDHS just recently released their monthly vital statistics for June. And so what we saw is, and I know there's been some questions regarding what's being coded at hospitals, and people are saying, well, everybody that dies in a hospital is being coded as COVID-19. But what we have from the vital statistics is we have actually quite a large increase of deaths in Arizona recorded in all. For the last, for June. So we have a 34% increase of deaths between 2019 to 2020 right now. That's an additional 1,576 deaths in June alone. So I went back 5 years of data to see how often June is an increase over May in Arizona, and there is not one year from 2014 on where May to June is an increase. And in this case, May to June was absolutely an increase. And like I said, it's 34% higher than it was in June.
So what you're saying is June is typically a lower month in deaths for us here in Arizona, but not the case this year by 34%?
So yeah, June. So typically our curve, our death curve, just our standard sort of death curve it's sort of it sounds horrible to say, but it's sort of a smile. So it starts high in January during the flu season, and then it's sort of when people are leaving Arizona, we have snowbirds that leave and other things, and so our curve actually goes down for the summer, and that's been the case for 5 years running, and this year is the exception to that rule right now, where June is the highest recorded death month of 2020, and it is again 33 to 34% higher than what it was in 2019.
It's so sad because behind every single one of these numbers that we talk about here is a family that's absolutely heartbroken. Yeah, we don't forget that in all of this. We want to get to some of the questions that are coming in as well. Donna asks, what are the ages of those who died? And we can help Donna find that number on her website as well, on the AZDHS site. It actually has a breakdown by demographics.
Yes. Pardon me. That same site that we just went to does have some demographic information on it. So we do have by gender, we have by age category. These age categories are fairly broad, but that's what we have. And then we also have some ethnicity data. So we have, like, for example, right now, 40% of deaths are coming from white non-Hispanic, 25% are coming from Hispanic or Latino, and this is with a 16%, so about 400 deaths that are uncoded right now for their ethnicity.
Yeah, so they're still waiting on more information from those. And Garrett, I want to get to, there's so many questions coming in, and we appreciate all of you joining us on here right now. It means everything. I'm getting messages from honestly all over the US right now that they're tuning into this. And although we use Arizona-based numbers here in our conversation, people are telling me that they're then taking this information and able to look up what it looks like in their area. And what I heard from a woman from Spokane, and I appreciate her sending me a message saying that she jumps on here and watches us every day because then she goes and applies this information to the area where she lives and gets better statistics and better data, and she can make good choices for her life as well. One of the questions that we always get, I just saw a few pop up, were about recoveries, and so let's just address that right off the top. There's no set definition or agreement on what recoveries look like. So the best number that we have for that is people who are discharged from the hospital. We do have discharge numbers, and you can find those for yourself as well on a website we use quite often, which is called covidtracking.com. At last time I checked it, it was about at 15,000, Garrett. Is that what you were seeing today? Have you been on that particular site yet?
Yes. So yeah, as you said, these are hospital discharge numbers. They are a proxy. They're an estimate. They're the best we have because we don't have anything from the AZDHS. So you have to remember in this discharge number that this is just simply a release of bed. So this could be people who were discharged and then readmitted to the hospital and then discharged again. So there could be multiple discharges in there. There could be deaths in there. There could be any number of other reasons as well. So and I'm not saying that it's not a good number. I'm just saying that those are sort of the numbers you have to, or the things you have to consider when you look at the discharge numbers. So 15,000 hospital discharges, and just assume that there's also about 2,500 deaths in there as well.
Yeah, it's not always good news that comes from it. But as we say here, it's great to follow several different metrics so that you can make decisions for your life. Isaac, but can we believe the numbers? Okay, these numbers in particular, Isaac, look at that little cutie on the page there. Isaac, these numbers are coming right from the state. And so
Yes.
there's been a lot of questions about the CDC and the request to bypass that information and send it straight to the White House instead of the CDC. This information that we're getting is straight from Arizona.
It comes from two sources mainly. It comes from the county health departments, who then feed information to the state health department, who is also doing their own investigations on these cases. And then it also comes from the hospital systems themselves. So those are the two systems. They go directly to the Department of Health. There is no shifting to it doesn't matter on the federal side if it's CDC or HHS. For the purposes of this data set, it does not matter for us looking at this data who is in control of the data on the federal side.
Yeah. I just had a question about what do you think about sending your kids out to school? So this is what a lot of people are talking about. For those of you who are watching and you're not here in Arizona, there's still a lot of discussion about kids and whether school will start on time. Arizona starts earlier than just about everywhere in the country. Schools here, some of them were scheduled to start in late July. My niece and nephew were supposed to start at that time. Their date has been moved back, as well as all in-person classes here in Arizona have been moved back to August 17th. We were expecting and quite frankly hoping for some information from the governor yesterday, just because people want to start planning their lives and feeling a little bit more settled. He did not give any indication on how he's going to move on these things, but he did say he will have answers in the next briefing. So that he's meeting with Kathy Hoffman, who is our state superintendent here, and with several other educators to try to get a handle on what's going to happen. In the meantime, this address that producer Carrie has added to the bottom of the screen is the best place to check on your particular school district in your neighborhood or where you're sending your kids or grandkids. It's www.abc15.schools or .com/schools. There's a great interactive map on there. So you can just hover over the map, find the school district, and find the very latest plans for that area. It's something that I would say is one of the most talked about things right now out there, because people are trying to make plans for their kids. They're also trying to make plans for themselves, whether they can go back to work. And that's a pretty difficult thing to do. As Garrett and I have learned, we're working from home, and for both of us, my kids are in the other room with Dad right now, and his daughter's in the other room. So we feel you. We know why so many people are interested in that number, and we'll continue tracking those changes. But that is the best place for you to find it.
So I saw something on the Facebook. It was sort of a challenge saying, tell us what the underlying conditions are. So I'm going to accept that challenge. And because although we can't get that on the state database because they don't give us any risk factors for the death numbers, we do have that for Maricopa County. So I will show you what the risk factors for these deaths are in Maricopa County, which is the obviously largest county in Arizona. So this is the Maricopa County Health Department's dashboard, and this is how they determine their risks. They've got 65, they've got the age categories, and they have chronic medical conditions as well as the highest risk. And as you can see on these numbers here, 76% of COVID-19 deaths have occurred with people over 65 plus. And then, and you have to look at these numbers separately, but 54% of all COVID-19 deaths came from people with a chronic medical condition that has nothing to do with age. That's just a chronic medical condition. And then 85% were either 65% or had a chronic medical condition. So the vast majority of deaths in Maricopa County have come from people over the age of 65 or have had a chronic medical condition.
So I find this chart helpful, but I also find it confusing. So I think it would help to explain to folks exactly what I was looking at in there. And I think I complained to you, those last two little charts, I wish those were moved, those factor charts, I wish they were moved onto a separate page, because what folks really need to do is separate those top four lines by the age category. And that's what you would add together to get that 100% mark in there. And when I first looked at this, it was confusing to me because I'm like, wait, we're getting what, 117 or
yeah,
127.
You have to look at it separately. So yeah, you'd pretend there's a line between 65-year and chronic medical condition. These are independent of age. So absolutely.
Right. So when all our viewers are on there looking at that, just make note of that. That was one of the things. Garrett, as much as we talk about some of this stuff on here, sometimes then the graph is later updated. So we'll just see what happens. Maybe they'll split that chart into two, so it's even easier to see. A really good question just came in from Ken. Oh, were you going to add something to that?
I was going to say, actually, it's funny you said that, but because Maricopa County changed their definition of long-term care facilities today. And so they took out that now the long-term care facilities deaths are now, or all cases and deaths are now only including nursing homes, assisted living facilities, and hospices. So this is a change from today. Prior to that, they had also put in congregate settings such as rehab centers, group homes, prisons, all this other stuff. And so now they've dialed that back to only the long-term care facilities, and the number of deaths have gone down to 43% of the total, because that did bring down the number of cases pretty dramatically, and then it also brought down the number of deaths about 8.
So is there anywhere else that other information that is split out from the chart, can we find that then somewhere else? I think let's see, they were at 76% on this chart when we first started tracking it. I even think some political ads were using that number in their ads. Then we saw it kind of dip down as we saw other age groups who are not as likely to live in some of these home settings being affected. The percentage rate went down to about 49 or 50, and now, as you're reflecting here, down to 43. Would there be somewhere else to find that, let's say, 7% out there?
No. The only other place I can think of is the Arizona Department of Corrections COVID-19 tracking, because the majority of the cases and possibly deaths, we don't know, that were taken out of these congregate settings was very likely from the jails, just because that's the largest kind of group of congregate settings that we have aside from these assisted living facilities.
Ken Lamb is asking a question, really good question. I have a question about RT scores or R naught scores. How do deaths affect the score? Deaths would not affect the score, if I'm not mistaken, because the R naught would be based on cases alone. Would that be correct?
You are correct. The R naught score should not be affected by increase in deaths.
Yeah. So Ken, I know we're seeing this high number of deaths, and that you would think that might factor in. In this case, it would just be based on cases, and then. And of note, the cases were pretty high today total. I mean, we're almost at 4,000 cases, Garrett.
Yes, and that the RT is pretty much. I mean, everyone has their sort of methodology of doing the RT. As you can, they're going to be very close to each other. But you know, what the most impactful stuff for the RT is the increase in the cases and the increase in the testing, the percent positive of that ratio. So that's going to have sort of the biggest impact. As you can see, we had a 0.98 yesterday. It's now gone up to a 0.99. So in 2 days, we've had a 2/10 of a point increase on our R naught score. We're still within under 1, so we're still within the green here. But you know, you have to take these error bars into consideration. This is an estimate. So our range, I'll see if I can bring that a little closer so people can see it. Our range for the R naught score is about 0.74 at the low end to 1.18 at the high end is where they think we are.
Ken's following up to his question, and I want to get it here. He's saying, but deaths lower the number of active cases, doesn't it? That would be true, but would it affect this that much when you have, say, 138,000 cases, the percentage of that being active and then being lowered by 91 probably wouldn't have an effect?
No, it wouldn't be a statistically significant effect on an estimate like this.
Yeah. Ken, really good questions. Thank you for that excellent question in there. Let's see. I had a question that just came by, or a comment that I thought was really interesting too, about the plateau or the perceived plateau. Joseph Hoffman writes, the reason for the plateau is because of the overwhelming number of tests to be processed are delaying results. So they're artificially creating a plateau. That's something that we've talked about on here, Joseph, that this possibility of a plateau could be a little bit too easy to, or too soon to get hopeful about, because these tests are being so delayed. Are we still seeing that great of a delay, Garrett, that this could affect that plateau?
So I'm going to just give me 1 second. I'm rendering my charts right now, and I can show you sort of what could be the problem. So we've sort of talked about this in the last couple of days, where you know, while we have been seeing some very encouraging numbers coming out of the AZDHS, there is also possibility that some of these encouraging numbers can be the delay in testing we've been seeing could be one of the impacts that is happening and occurring to these sort of encouraging numbers. So I'm going to share my screen really quick, and these are sort of my internal epi curve, and you can see originally I haven't updated these yet, because you can see that moving average, that used to be a 7-day moving average, and I cut it off at about 7 days. And now there's a lot of light blue, which is filled in today, that's coming past that 7-day rolling average. So I have to recalculate this to see what we're really looking at. With that average dropping off so dramatically, this could be, we don't know where this week, as you can see, this is sort of a collection that makes up about a week, and we don't know where this is truly going to end. And you know, this is the week prior to our peak. Does this week, which is this last week, this is the July 4th weekend, does this how far up does this push? And what is the delay in testing going to create for this? Because you can see there's a delay in both of the case and the epicurve graphs. So we don't know where this is going to end up. We hope that this is going to this July 4th weekend is going to be it's going to be significantly less when all tests are processed, but we just simply don't know yet. So, you know, it's going to take, unfortunately, a couple weeks to figure out what's actually going on.
Yeah, and Joseph writes a follow-up to that. Can you factor this into your data? Yeah, I think that factor would be the yellow line. So the yellow line is basically the cutoff of where you were trusting your data that's coming in, right, Garrett? So it's almost like you would have to trim that yellow line back to say, when there's a delay in testing, my yellow line needs to sort of.
Yeah, when we were kind of climbing up that hill, I had cut that yellow line off at 7 days. So I said, I don't want the average to factor in anything after in the most recent 7 days, because it's always going to drop off precipitously, and so the line will always look like it's going down. Now the line can go down. I don't want to see this line just keep going up, right, but I want it to go down for the right reasons and not because dates are still being filled in.
Well, yeah, you want to be able to trust exactly what the numbers are. Boy, these are good answers and questions that are coming in today. I think everybody got a good night's rest last night to be able to provide us with such awesome insight, and you guys are getting it. You guys are understanding all these numbers. So I love this conversation today. What other numbers were you watching closely? I know you know, so much has been said about where Arizona is ranking in the nation. And not for good reason. We were on the top of the charts, number one, in a place we don't want to be with these COVID cases, and in some cases these deaths. How do things look now? Where does Arizona rank? Some other states, I think we reported to everybody here that during this week, Florida had taken over. One of the things we talked about is looking up the exact population of Arizona and comparing that to Florida. In Arizona, we're about 7 million people. In Florida, there are 21 million people. So when you guys are hearing reports of 15,000 cases reported in the last 24 hours in Florida, so you divide that by 3 to see what that would look like for Arizona numbers, and that would be about 5,000. What we're seeing today is almost 4,000. So we're not at the top. We're not at the top of the charts anymore. We are passed by Florida. Have we been passed by anyone else in any of these categories that you have seen, Garrett?
Yes, we were passed by Louisiana as well. So I'm bringing up 91-dvoc.com. That's COVID-19, excuse me, COVID-19 spelled backwards. And this is a chart that a professor put together to do some very high-level statistical analysis, but still have it accessible to the public. And so what we're looking at is the cases normalized by population by state and territory. So as you can see, the data I have right now is new cases with a weekly average. And you can see that Florida, Louisiana are now above where Arizona was. We did have the dubious distinction of having the highest day in the nation a couple weeks ago, and that's since been passed by Florida today. However, this isn't all good news for us. We do also have, if I look at the new deaths per week average, as you can see, as of right now, as of today, and as of yesterday as well, Arizona has the highest per capita death rate in the country from COVID-19.
Wow. Garrett, where is that chart? 91-DVOC, so COVID written backwards?
Yes, 91-dvoc.com/pages/COVID-visualizations. I'll take you through it right now just so we'll go from the very beginning to where I found it so everyone can kind of figure out how to get there. So this is the home page of this. You would go to all 91 or all COVID-19 91 visualizations, and then right here to the global one. And this is where I was. So here's where you can go to look at that number and again, just kind of see where we are per capita.
That graph was interesting on the top of the page there, to watch it autofill like that and to see where we've come. I'm assuming it's starting back in February or March, but
Yes.
When you were first showing that page, it was filling in. It's just incredible to see what we have all been through, what we have all survived in all of this. Peggy's asking if 85% are people over 65 and existing health factors, are masks and social distancing really helping? So can we go back to that page with the number with people who are of those specific groups, those age groups?
Yes, let me get there. Okay, we'll go back to risk factors.
So
again, Maricopa County only.
Yeah, that's what I was going to say. Go ahead.
Oh, no, please continue.
I was just going to say that this is Maricopa County only. So, Peggy, we're assuming that you're in Maricopa County or that these are the numbers you're looking for. Message us on here if this is not. We can take you to some other areas. But Maricopa County just has some really thorough numbers, so we can help you see what this chart means. And Peggy, and specifically, is interested in that last line of highest risk. So that would be both over 65 and existing factors. Can you break down those percentages to the side and what that means?
I'm sorry, Katie, was that to me? I apologize.
Right where you were hovering over, that's perfect.
Okay.
What does that 85% then mean? Is she interpreting that right to say?
Yeah, so I apologize. So yes, yeah, she's interpreting it as 85% are over 65 and have existing health factors, and that is the case. As far as masks and social distancing really helping, that is a question for scientific studies at this point. The way that the data is coming in, it would be just because of how quickly all this data comes in and how long it takes. It takes anywhere from 2 weeks to 4 weeks to get a complete look at the data. There's really it's difficult for us to see what it truly can do. All we know is that as of right now, our cases and tests have been leveling off. Do we know if that's from the mask mandate or is that from a lack of testing right now? We just don't know the answer to that. And that's just something that will have to be kind of brought out over time to figure out which one is it.
Yeah. Erica's asking, can you help me through the Yuma County numbers? She's finding it still to be confusing. Erica, we're happy to help you get a closer look. Garrett, what do you think, starting on the Arizona Department of Health page so she can highlight her specific county?
I'll take you actually to the Yuma County
itself
coronavirus page, because they're always a little bit more. Yuma's one of the better reporting counties, and they're always a little more updated than the state. So I'm going to share this screen. I can't give you the URL because it's just way too long. But if you Google Yuma County COVID-19, you'll find it. So this is where we are for COVID-19. You have 55 cases and 172 deaths. And this is what I was talking about. When you look at the death number for AZDHS, they have Yuma at 165. So the one thing about this, I don't think I can share my screen on this, but if you open up that daily update, they put some charts and some PDFs, and let me see if I can bring that up. Yeah, I can bring that up. It's just a full screen here, and just really be able to go through what these numbers look like. So this is kind of sort of Yuma County's numbers in their sort of AZDHS site here. You've got cases by age. You've got their one of the things they do that others don't, which is great, is the Arizona surge line transfers. We've seen that over the course of the pandemic, 150 total have been transferred out of Yuma Regional Medical to other places. And you can see right here, they've got hospitalizations total that are in ICU as of right now. I can tell you just by watching this that this is a number that is much lower than it was a couple weeks ago. And so this is sort of where you can go to look at a more precise look at Yuma County's numbers. And said this is a PDF that comes up when you click that link.
Yeah, that's helpful. And then, of course, each county has a look at that. I'm seeing everybody post their help with Pima County, too.
I mean, we can go through all the county numbers all day. So I just know that virtually all the counties, with the exception of Pima, does not do any independent reporting, but all the counties do have something either on their Facebook page or their county health department page. Other than that, in fact, all of the numbers I get from the counties, because I every day collect numbers from the AZDHS and the county numbers, and I go to Facebook pages, I go to their county health department pages, and I just kind of collect wherever I can find it. So you will be able to find this data if you want to look for it for your county.
Yeah, and if there's any specific numbers in there you need help finding, we can do that.
Yes, and there are some counties that give us more information that AZDHS doesn't. So like I've said before, Yavapai County gives information on minors as far as the case numbers that none of the other counties do. So there, every once in a while, and there's also recovery numbers in some of the counties. Coconino gives a recovery number, Gila gives a recovery number. So there are other there's other information in your county. If you really want to look at that, you can find it on their county health department or their Facebook page.
Yeah, it's definitely worth diving into. And I want to talk about, you touched on minors there. You touched on the kids who are dealing with this. Boy, we did a story on a 2-month-old yesterday, a first-time mom. I can't imagine going through that the first time you have a baby, to have a baby in a pandemic, to deal with all that at the hospital, and then come home and then also find out at 2 months that your baby's tested positive. So I want to get to kids on that real quickly. Chris Robinson writes, first time watching here. This is so much better than TV news. Love the interactions. Chris, thank you. That's why we're on here each day, is to help everybody find the information that we don't have time to dive into during our newscasts. So the newscast gives an overview of news of the day, helps you find places to deep dive into the stuff, but we will deep dive right here. We're usually with you for about 30 to 45 minutes each afternoon. Weekdays we'll be off tomorrow and Sunday, but Garrett, I always see that you're posting those numbers on your Twitter account as well. So folks wanted to find those numbers. So Chris, we welcome you for the first time, and thank you for leaving that comment. On to the kids, Garrett. Oh, everybody's talking about schools. Everybody's worried about their kids. Obviously, cases in kids are more rare than in adults, and we're not seeing the spread from kid to kid as much as we're seeing that in other age groups. But what are you finding on the kids here in Arizona?
I'm finding exactly what you just said. So if you look at the case numbers for Arizona, for the demographics, now again, all we can go off of is the 0 to 20. So this includes sort of this huge number. Obviously a 5-year-old is not the same as a 16-year-old. But when we look at the Yavapai County numbers, and you can take Yavapai County sort of the younger numbers and sort of and I don't want to say use them as a proxy because the Yavapai County is too small, but at least gives you some idea of what things look like. And I can tell you that only 3% of their infections are coming from 0 to 12. So it's an extremely tiny number for that specific age group. Unfortunately, with Yavapai County, we can't use the 12 to 17 as any sort of estimate, simply because they had a outbreak of COVID-19 that hit a kind of a congregate setting high school over there several weeks ago, and that ballooned their numbers from that 13 to 17. But their 0 to 12 numbers only 3%. It's a very low number, and we can see that reflected in the AZDHS numbers as well. When we look at them as a per capita basis, we can see that group 0 to 20 is also the least impacted of the other age groups when you kind of equalize their populations with each other. So, I mean, right now I can say that while we're looking at this, we're watching it, but we're seeing that the that age group is still lower right now. I mean, it's not spreading at the same, and in fact, it is actually spreading at a lower rate than it used to as well.
Yeah, and I think that's one of the conversations around sending the kids back to school, is that it's a lower rate among kids, but we have to remember, I know everybody's thinking first to their own kids, but we have teachers to think about and staff to think about. We have all the educators there, and that's one of the considerations of whether these kids can carry it to our beloved teachers. And another conversation I heard about, what this sort of devastation, if there is a loss in a school setting. I don't know, Garrett, if when you were in high school or grade school, if there were a child who passed away, that rocks a school district. That is something that that's why they bring in so many grief counselors right away, to help these kids through it, because for a lot of these children, it's the first time, thankfully, but that they've been through death and they've experienced these things. And so this has to be considered in taking care of these kids who are going to maybe be the ones to survive this, but go through the grief of losing a beloved teacher. That is so hard, and something that will stay with them for life. So that is definitely a consideration in all of this, and thinking of all of our teachers as well. We were talking earlier about some of these COVID tests and breaking them down by the millions, so that we can get sort of a broader view of how things look. Were there any graphs on that, or anywhere you wanted to peek at to help illustrate that?
On what, the COVID test?
the COVID tests per million, so we can help understand sort of the per capita, if you will.
Oh, of the tests. Okay. Yeah. Yes, we can go back to actually DVOC 19 to see that number as well. If anybody is interested in that, we can see they actually do have new tests with a weekly average. And here you can see, we saw some very high per capita numbers for us on cases and deaths, but here for Arizona, we're quite in the middle of the pack when it comes to testing normalized by population. In fact, if you sort of look at that, we're sort of on the slightly lower end of the middle of the pack for this number.
Mm-hmm. Yeah, worth noting in there. Any of the other numbers? It looks like we're almost running out of time already. The time goes by so fast here. So if there are any final questions you want to get in, and Garrett, if there are any numbers that you were noticing overnight that we should maybe continue tracking closely for the weekend. People were asking about recovery numbers. Around 15,000, again, is the best number that we have yet today, and that's based on discharges. So if you rewind a little bit in this, we'll have even more information when we talked briefly about recoveries early on.
On Bijan's question, as far as the recoveries by people who self-quarantine and not hospital, that's actually that's the estimate that the AZDHS has not agreed upon. So is that number 14 days? Is that number 27 days? Because that's sort of where, for a younger person, recovery self-quarantine, about 14 days. But for someone who's in their 50s or 60s, that self-quarantine, or at least that recovery period, could be closer to 27 days. So that's sort of why we're not really sure on a recovery number yet, because we can post one for 27 days, we can post one for 14 days, but we just have to get it really solid, because we don't want to report one that is not correct.
Yeah, as we always not up to us to define. As soon as we have that definition, we'll report it to you there. Brant's writing, thank you, Katie and Garrett. You're awesome. Thank you, Brant, for joining us on here. We appreciate you taking time out of your day, and we hope that we're able to answer some of the questions that you have. So over the weekend, Garrett, what numbers will you be watching the closest? I mean, we're going to be having this hopefully ramp up of testing that's happening. That's been the governor's big push, is to get more testing out there. We saw a slowing of responses or results in the testing, and that could be affecting some of the numbers that we're getting in. So we're keeping that in the back of our mind. What else are you kind of going to be pondering this weekend and watching when these numbers come out?
Well, we're watching right now. One of the things that's been the closest sort of concentration for everybody is those hospital asset numbers, which are not impacted by weekend reporting. So this is, we're going to be sitting here. Saturday is going to be sort of, if you think of everything as far as a 24-hour period. So obviously today's reports are from yesterday. So Saturday's reports are from Friday, but Sundays and Mondays are from Saturday and Sunday. So we're going to get a very low death number. Well, we may not, but yeah, most likely we will get a lower death number. We'll get lower case numbers, but the hospital numbers don't change. They stay constant. So I've shared my screen to just go over some of the hospital numbers. We can see right here, we went, this is that June sort of pick up all the way to the middle of July, or the early July. And we've seen that acute care patient beds, inpatient beds, these been leveling off. They're not increasing anymore, and they haven't been increasing since early June. This is very good news. Ventilators, however, they hit a record again today. So what we're seeing is, while our numbers in acute care and general patients are leveling off, we're seeing sort of the ICU we're in a stress moment for the ICU. So, and we might be there for a little bit of time, because as you can imagine, ICU lags inpatient. So while we have a leveling off right here, we're probably just starting the leveling off for the ICU, which means we're going to be just starting the leveling off for the ventilators sometime this week. And then going back to emergency discharges, we can see we still have a lowering of this trend, which is good, because this is probably the best leading indicator we have of what the community spread looks like. And as this number goes down, this is sort of one of the more encouraging things to see that. So, and then also, just for anyone who wants to see the discharges, here we are. We're back at sort of where, we're still sort of in the same pattern we were in early July for the discharges. So all of these numbers are very important, and we're going to be watching all of them this weekend.
Someone just asked for a brief recap that they got here just a little bit late. And there, Joyce, I must have missed it. What are the numbers of cases and deaths put out for Arizona today? We had almost 4,000 cases. So today's case count was 3,910, and lives lost to this here in Arizona at 91. So that brings our total to 2,583. Let's see. I wanted to get a few more questions in, as we just have a matter of minutes left on here, Garrett. Yeah, Veronica's posting, my dad tested positive after he passed away. We're seeing that in some cases too. Let's see. My gosh, I just saw another question I wanted to get to. Dorothy's asking, are they slowing down testing based on the heat? We have not heard any slowing down because of the heat. In fact, it seems like there are more test sites popping up around the valley that you can register for. They're seeing those long lines and trying to get people through even faster. I mean, we were having to warn people to show up with a full tank of gas and bottled water so that they were able to wait out there for that long. So it sounds like, we're trying to get people through faster so that that's not an issue why they're out there waiting. Nicole Burns, why is it so hard to get a test? Again, hopefully this weekend will help. If you're looking for a test site, let's see if we can put up that Emory Women's Health website where Nicole, if you're looking to get a test or someone you know is, here's the site, EmoryWomen'sHealth.com/testing dash blitz / there we go. It's right there on the screen for you. I'd copy that one down just because they're a 24/7 site. They have 2 bus routes that are nearby and that you can sign up for a time for them to have you come out, so you won't have to wait out there for so long. Some of the other sites, as we were showing, were pretty long, but boy, that's and
Sandy Bartlett says, is testing open at CVS? I believe they are, right?
I think so. Yeah, at last check. Call before you go, obviously, so you can find out more info, but at last check. Let's see. Anything else we need to get to before we sort of wrap this up for the day? Oh, Karen's saying she went to Emory and it was fast. Hey, good. Karen, hopefully you're going to have good results soon. If you haven't gotten the results already, let us know if you have, but that's good to hear. Yeah, Sandra, I just got tested. So hopefully some of these places we've been talking about and showing you that you can go is helpful to you, and you're able to not have to take so much time to spend over there waiting for a test. That's the last thing that should happen. You shouldn't have to wait long for a test. You should not have to wait long for results. Peggy Wolf is asking who should be tested. At this point, they were saying anyone who wants a test should be able to get a test. Obviously, we saw this massive delay over the last couple of weeks, but it seems like over this weekend, they want to test, I believe it was 60,000 people is how many tests they
35,000 this weekend and 60,000 the next weekend, I think it was.
Yeah, like so they're clearly trying to push a lot of people through, because here's the thing, the more data we have, the more numbers we have on this testing, then the more information we're going to get to be able to figure out how to get this thing stopped and how to get this thing under control. So, all right, Garrett, I think that's going to wrap things up on this Friday. Thank you. Oh, thanks to Margaret for writing that. We are happy to be here to help you find all this information. And like I said, the people who are sending notes after, it means so much, because we're wanting to take time out of our day to help you all find where this information is. I always say, you make the best decisions for your life. And we're just here to help you find where those numbers are. Oh, Roseanne says she did the CVS drive-through yesterday. Easy, well run. You swab yourself, well organized. Roseanne, how is that? I've seen that, some of those places, the self swab. I might have to take a deep breath before I'm able to do that. That's pretty brave. I don't know. Garrett, would you be okay? You're a tough guy.
Oh boy.
I just always am like, somebody else do it. I don't want to make a mistake inside my own nose. All right. So we won't be here with you tomorrow to go over the numbers, but we will be back on Monday to be able to help walk you through any numbers. Of course, as always, the numbers are still out there every 24 hours. They're reported every morning. Garrett does a breakdown on his Twitter account. You can find him on Twitter at Garrett_Archer. You can find me on Twitter at Katie Rammel. You can also find me on Facebook at facebook.com News from Katie. And then, of course, a wrap on all the news that's happening today will come up on ABC 15 News at 4 in about 90 minutes at 5, 6, and 10 p.m. Be safe this weekend, everybody.